1. The American Heart Association has released new CPR guidance in response to the pandemic. 2. The guidance recommends wearing a mask and other PPE during CPR. 3. Experts say people should wear a mask when performing CPR outside of medical settings. 2. The American Heart Association, AHA, has updated its cardiopulmonary resuscitation, CPR, guidelines to protect healthcare providers during the COVID-19 pandemic. The interim guidance was released on January 24, 2022, and advises healthcare providers to wear a respirator, like an N95 mask, along with other personal protective equipment, PPE, like a gown, gloves, and eye protection, when performing CPR on people with a suspected or confirmed case of COVID-19. The AHA stressed the importance of wearing the appropriate PPE before performing procedures that can produce aerosols like chest compression, defibrillation, bag mask ventilation, and intubation. In the event initial responders are not already wearing appropriate PPE, they should immediately put on PPE and then begin CPR, the AHA said in a press release. As the science surrounding COVID-19 and variants evolves, healthcare professionals should continue to follow the most up-to-date recommendations from the World Health Organization, Centers for Disease Control and Prevention, and their regional health authorities and local institutions. The AHA also noted that heart attack survival rates have dramatically decreased during the pandemic, noting that the reasons for this decline are both unclear and complex. Survival of a heart attack is dependent on early initiation of CPR, including chest compressions as soon as it is safely possible, the AHA said, adding, patients with confirmed or suspected COVID-19 should receive the best resuscitative efforts possible. Doing CPR immediately can double or triple a person's odds of survival after a heart attack. CPR helps keep a person's blood flow active and raises the odds a patient will be able to be successfully resuscitated once trained medical staff is available. CPR saves lives, and it is important in the midst of a pandemic to ensure that those performing CPR are aware of what PPE will keep them safe during this procedure, Amesh A. Adalia, MD, a senior scholar at the Johns Hopkins Center for Health Security, told Verywell. The new guidance raises some questions, including what this means for people who need to perform CPR outside of a medical setting. Here's what you need to know.